Today I'm going to talk about the serious signs and symptoms of severe whiplash injury. And there's some of these that you should never ignore. Most people think a whiplash injury just caused a stiff neck. Well, I'm going to tell you this. The surprising truth is ignoring this, ignoring a whiplash injury can lead to long-term pain, nerve damage, and sometimes permanent health problems. And some of these issues won't show up until it's too late to fix. I spent over 30 years helping people recover from whiplash injuries, and I can tell you this: if you don't recognize early warning signs, you're risking your future of health without even realizing it. In this video, I'm going to show you the 5 symptoms of serious whiplash that doctors often overlook, and you cannot afford to ignore number 5 because it's the most serious, sometimes life-threatening. The simple proven steps to start healing quickly, and how to prevent long-term damage or chronic pain that can ruin your life for so many people that this has happened to. By the end, you're going to know exactly what to watch for, and but more importantly, how to take action, how to talk to the doctors in your area to take care of you so you can protect yourself, your family, and your loved ones without feeling overwhelmed or unsure. I'm Dr. Gregory Kramer. I have over 33 years of clinical experience, and I'm certified in chiropractic biophysics, which is the #1 recognized structural rehabilitation care. Now, one of the things that I always talk about is I take care of chronic health problems. Well, sadly, I take care of chronic whiplash, chronic disc problems, chronic neuropathy, chronic foot problems, a lot of things that affect your ability to walk. But I can tell you this: it's always easier to correct small problems after an injury than let them heal incorrectly with tons of scar tissue. So correcting small problems first always takes the place of waiting until it's too late. I use a variety of non-surgical methods. I use mirror image adjustments, exercise, traction. I use spinal decompression when you have compressive issues, compressed disc, both the neck and the back, a compressed nerve that could affect your feet. And I use targeted exercises that you can do at home. So we combine adjustments, exercise, traction, home care, and spinal decompression so that your body has the best chance to heal and repair so you can minimize pain, avoid surgery, and live stronger longer. What happens during a whiplash? Well, if you've ever been in a car accident, you know how fast it happens. The sudden jolt, your body snaps forward and backward before you can even react. That's a whiplash injury. Whiplash occurs when you have a sudden force will whip your neck forward and backward. It can tear the muscles, but more importantly, it can overstretch the ligaments. Now remember, ligaments hold you in alignment. They're connective tissue. So if the ligaments are damaged, you're gonna misalign. And it doesn't take a high-speed crash. Sometimes even a low-speed collision can cause significant damage. And it depends on the person, right? So obviously, if you're a tall, thin person with a thin neck, you're more likely to be injured. If you have a short neck, if you're a wrestler with a real thick neck or a football player, sometimes the car could be totaled and you're not hurt. So it always depends on the individual. Most people don't realize that it's not just your neck that's affected, but remember, if there's enough force to whip your head back and forth, what's inside your head is your brain. And so sometimes, in fact, many times, this can irritate the brain and the nerves and cause subtle brain injuries or concussions. Now, at first you might feel fine, but you might have pain, stiffness, dizziness, and sometimes it's immediate, but sometimes it may not show up for days, or it could weaken you till it shows up sometimes a week later, like you've torn the connective tissue, and over time, the body gets further and further out of alignment until you have a crisis. The good news is that many of these injuries are treatable, and with the right care, and I'm saying the correct care, you can fully recover. Recognizing signs or early signs is the first step towards healing. In this video, I'm going to show you exactly how to protect yourself. Now, there are 5 severe signs of whiplash you should never ignore. Number 1 is severe neck pain or stiffness. Persistent neck pain and stiffness are often the first and most obvious signs of an injury. Most people assume that it's muscle soreness. Well, you'd be lucky if it was only muscles. Muscles are on the superficial level. Muscles have a good blood supply. But the reality is, most of the time when a significant whiplash happens, you're injuring deeper connective tissue, ligaments, facet capsule ligaments, the disc that hold you in alignment. and that can lead to chronic pain if it's not diagnosed. And if you injure it severely, you start getting a condition called instability. Now here's the clicker, and I'm going to show you this in a minute. To accurately assess these injuries, use a diagnostic tool called a cervical motion x-ray, or where you're going to flex and extend your neck. And you're going to compare that to you sitting still. And this will show what areas have the damage and to what degree. It's going to show the location and the severity. Is it mild, moderate, or severe? Now remember, these injuries are measured finding. It's not guesswork. All right, and I'll start to show you that in just a second. In cases of whiplash or overstretch or torn ligaments, that causes the vertebrae in the neck to shift, sometimes creating an unstable spine. Instability can lead to chronic pain, stiffness, weakness, and a host of other conditions. By identifying these instabilities early, and that's the key, early identification, you can target exact treatment in that area and create a personalized treatment plan to stabilize your spine, reduce your pain, and prevent chronic deterioration. This is the setup for an x-ray of your spine. Now, there are only a few things that can happen when you have an injury to the spine. Either you break the spine, like a fracture, or you have a disc problem, or you have a ligament problem that holds you in alignment, or you could have all three. So typically you can injure what's inside the skull, which is a brain. You can injure your spine, the nerves, the spinal cord. This is a lateral or the side view of the neck. As you see here, there should be a curve of the neck, like a banana. This person does not have the proper curve. So we already know that there's a problem here. Now what we're going to do is we're going to do an x-ray where the person bends their head forward. And what we can do is we can compare you bending your head forward versus you standing still. So what we want to see is a nice smooth arc. Now this particular person, without even measuring it. Now normally we need to measure using a computerized tool, but just looking at this, I can see there's lack of motion here, too much motion here, and then we also have lack of motion on top, okay? So I can already identify areas that are not working properly, and I can target the types of care that would be best for this patient to reduce pain, improve alignment, and prevent chronic problems down the road. All right? Now I'm going to show you what we should see when you bring your head back or an extension. So this is what the picture looks like when you bring your head back. But if you notice, it kind of looks like they're just bending at the top. Notice how straight this lower area is. So instead of the whole neck going back, it kind of looks like this individual person, this is not a patient of mine, this person is just kind of doing this, where this upper neck. Now I can see this vertebrae right here, C3, this is number 3, number 2, is starting to go backwards or posterior, what we call a retrosthesis. So we know there's some ligament damage here, and that commonly will correlate, if you looked at an MRI, with either a bulge or a herniation. So we know there's some damage here. We know this part of the spine is not moving enough. So by taking these flexion and extension x-rays, we can target where we adjust, where we don't adjust, exercise, and traction to restore the natural curve. So this is probably the most important tool to diagnose a whiplash injury is a flexion extension. So whoever is taking care of you needs to understand the value of this, and then should design your treatment, should personalize your treatment based on what we found here. So we talked about things like headaches, neck pain. We need flexion extension x-rays. We also talked about, very simple, if you have pain going down your arms, we might need to get an MRI of your neck. So the second symptom to be concerned about is neurological symptoms. Remember, nerves are inside of your spine. And when the bones are out of alignment, they're going to pinch, stretch, irritate the nerve. That can cause tingling, burning, numbness, or even loss of grip strength. So again, you don't want to ignore those types of signs. So tingling in your arms, numbness in your hands, loss of grip strength, that's a significant sign that the nerves in your spine are being compressed and irritated. If you leave that untreated, this nerve compression can lead to permanent damage, leading to weak muscles and even a loss of function in your hands and arms. Many times these symptoms don't resolve on their own. Delaying care can mean risking permanent neurological damage. It's crucial to address these issues early to protect your mobility and nerve health. Again, the longer you wait for treatment, the more scar tissue builds up. Anytime you injure connective tissue, the body will heal with layers. Think of scar tissues like gristle in a cheap cut of meat. Now, the third sign of whiplash that you should never ignore is dizziness or balance issues. So dizziness after whiplash isn't just an inconvenience. It's a sign that affects your ability to maintain balance. Your body is losing that ability. Now, dizziness could come from the brain, the ears, or the spine, or all of above. So there are many areas of the body that can lead to dizziness, and they all need to be evaluated, okay? If you leave dizziness untreated, it can make even simple activities, walking, climbing stairs, driving, horribly unsafe. Now that leads to risk of falls, and that's a whole nother issue. Frequent dizziness or balance problems should never be ignored, and this could indicate more severe damage that needs immediate attention. Now, the fourth one is getting more severe now. We're talking about cognitive or psychological changes. A whiplash injury doesn't just affect your body. Remember I talked to you about that in the slide prior. It affects the brain. It affects mental health. So many people experience symptoms like memory issues or brain fog or mood changes, irritability, depression. These are cognitive and psychological changes often stemming from subtle brain trauma, mild concussions, or the stress response triggered by the accident. If you leave this unaddressed, guess what? These changes can disrupt your ability to work, maintain relationships, or perform your daily tasks. That leads to more chronic stress, which exacerbates the physical symptoms and delays healing. Again, we don't want to delay healing. So many times you need a team on a whiplash, all right? My experience over the last 30 years, you want to find a corrective chiropractor that has experience dealing with crashes involved with automobiles. All right, so a corrective chiropractor is kind of like the quarterback on the team. And then if you have signs of closed head injury, he'll send you to a physician that specializes that. And usually the tests that you will get that help you will be the motion x-ray, an MRI, and then other diagnosis tests looking at the brain. Now this is the scariest, and this is the most rare, but it's called a brain bleed. Although it's rare, brain bleeds are the most dangerous consequences of a whiplash. The force of the injury can cause blood vessels in the brain to tear, lead to internal bleeding. This is the scariest. So severe headaches, confusion, nausea, vomiting, vision, slurred speech, drowsiness are not just warning signs. That's an emergency. All right. This is where you need to go to the ER. You need to get either a CAT scan or an MRI, and that's critical to watch. All right. If you experience any of those symptoms, seek emergency medical care immediately. Do not delay. Brain bleeds can escalate rapidly. That's where you hear about the wake up and die syndrome. All right. So this can lead to permanent brain damage, even death. Acting quickly can save a life. So a brain bleed can cause life-threatening complications, including death, permanent brain damage. So again, immediate emergency medical attention is necessary if you have these symptoms. Although it's rare, you need to react fast. All right, what do we do now? Okay, taking the right steps after a whiplash injury. Not everybody needs to get a CAT scan. However, if you have signs of a brain bleed, you should rule that out first, all right? The next most important test would be a motion x-ray, but you need to find a doctor that knows how to utilize that information. A motion x-ray guides treatment, guides what you should and should not do. And in my experience, over 30 years, seeing over 200,000 office visits, you want to find a corrective care chiropractor that has experience with automobile crashes. All right, that's super important. So when should you consider a corrective chiropractor in your area? Now, how do you find a corrective chiropractor? Well, this is my experience. I'm here in Livonia, Michigan. However, you are somewhere in the world. I would look up idealspine.com. Look up idealspine.com in the doctor directory of a corrective care chiropractor near you. I would call them up and ask, do you have experience dealing with automobile crashes? So if you have severe neck pain and stiffness, you would absolutely need to find a corrective chiropractor and get a motion x-ray. If you have neurological symptoms like tingling, numbness, weakness in your arms, legs, or hands, that's commonly from something misaligned in your spine. Many times, chiropractic adjustments correcting your alignment can alleviate the pressure, restore proper nerve function. If you go to my website, you're going to see many people that we've helped that have chronic whiplash. That means they had a whiplash. They didn't come to me right away. It's certainly easier to come right away, but many times I see them years after the accident. The next issue would be if you got dizziness or balance issues. Many times these symptoms result from disruption of the neck area, a misaligned spine, areas of the bones that are out of place putting pressure on the nerves, a reverse cervical curve. All of those things a corrective care chiropractor can address without surgery, without drugs. Chiropractic care is especially valuable for immediate pain relief and long-term stability. Gentle, precise adjustments. Your chiropractor can help restore your body's natural alignment, reduce inflammation, and set you on the path to healing. So again, when do we seek immediate medical attention? So remember, there's different degrees of whiplash, all right? But if you have signs of a brain bleed, like a headache that you've never experienced, severe, if you got confusion, nausea, vision, extreme drowsiness, you need to get your brain evaluated immediately. Do not wait. If you have neurological symptoms, tingling, numbness spreads, if you're losing strength in your arms or hands, you need to get not only a motion x-ray, but an MRI. Severe dizziness or loss of coordination. If dizziness makes it difficult to stand or walk, or if it's accompanied by fainting, you need emergency medical attention. Probably you need to look at your brain. You need to get a CAT scan or MRI. If you have cognitive or psychological changes, mood swings, confusion, you need to get your brain evaluated. For the majority of people, and I can speak over the last 30 years of treating automobile crashes, whiplash injuries, most people need a combination of corrective care with some medical oversight, particularly evaluating the brain. Okay? Again, a brain bleed is rare, but if you have signs or symptoms, get that addressed. The best approach is to have a team approach to address both the brain and the whiplash injuries. Again, in my experience, a corrective care chiropractor certified by Chiropractic Biophysics. Go to idealspine.com. It's an international group. Find doctors that are certified and the rehabilitative approach. That means they treat you as an individual. They diagnose you. They're going to do x-rays, motion x-rays, and they have the experience, the talent, and the knowledge to help you go from an acute injury to a stabilized patient, all right? The earlier the better, that's the key. The key is to act quickly. The longer you have symptoms, the more scar tissue, the longer you leave it undressed, the harder that it is for the body to heal itself. Whether it's stabilizing your spine, addressing nerve irritation, or ruling out a more serious complication. The right care at the right time can help you recover fully and avoid long-term pain. When you injure those ligaments, that can lead to chronic pain and disability. In fact, ligament injuries are the #1 cause in the United States of chronic pain and disability. So you need to get an early diagnosis, early treatment as soon as you can. Whiplash injuries can be overwhelming, but you don't have to face them alone. Understanding when to seek chiropractic care, when to get medical help, you're taking the first step towards healing. There's hope, and with the right support, you can get back to living pain-free. So I want to leave you on this note. The key points are: immediately make sure that you get your brain evaluated if any of those symptoms of a closed head injury. Number 2, make sure you find a corrective care chiropractor that addresses the cause of the problem. And everybody should be taking a motion x-ray. That will guide your care. That guides what you should do at home. That guides your exercise. That guides your rehabilitation. It guides where the chiropractor adjusts, where they don't. It guides your traction. So a motion x-ray is key. And then if you're having any signs of a compressed disc, you have pressure on the nerve, if you have any type of symptoms going down your arms or legs, you need to get an MRI. Before I forget, if you like this information, you know what to do. Like it and share it. Share it to a friend or loved one that you feel would best be interested, all right? If you feel that they're in trouble, help them out. Now, the next video you should watch is this one, where I dive deep into whiplash injury, causes, symptoms, and corrective treatment. Go watch right here.